ಹೃದಯದ ಮಾತೊಂದ ಬಿಚ್ಚಿಡು ಬಚ್ಚಿಟ್ಟ ಮನದ ಕನಸೊಂದ ಹಿಂದೆ ಸಮಯ ಮುಂದೆ ಇಡಲು ನಮ್ಮ ಹೆಜ್ಜೆಯ ನಿನ್ನ ಸಾಹಸ ರಥಕ್ಕೆ ಸಾರಥಿಯಾಗಿ ಮುನ್ನಡೆಸಿದೆ ನಿನ್ನ ಬಾನಂಗಳ ಕೆಳೆದೊಯ್ಯುವ ರೆಕ್ಕೆಯಾಗಿ ಕೂಡಿದೆ ಬೆಂಗಳೂರು ವಾಯ್ಸ್ ಬೆಂಗಳೂರು ವಾಯ್ಸ್
Bengaluru Voice. Listen to your heart.
ನಮಸ್ಕಾರ ನಮಸ್ಕಾರ ಬೆಂಗಳೂರು ವಾಯ್ಸ್ ಕಾರ್ಯಕ್ರಮದ ಈ ಸಂಚಿಕೆಗೆ ನಿಮಗೆಲ್ಲರಿಗೂ ಸ್ವಾಗತ ಸುಸ್ವಾಗತ. ನಾನು ದೇವದತ್ತ, ನಮ್ಮ ತಂಡದವರಾದಂತಹ ಸುರೇಶ್ ಬಾಬು, ಗೋವರ್ಧನ್ ಗೌಡ, ರವಿ ಪಂಗಾಲ್, ವಿನೋದ್, ತೇಜಸ್, ಲೋಕೇಶ್, ಪೃಥ್ವಿ, ರಮ್ಯಾ ಮತ್ತು ಅನು ಇವರೆಲ್ಲರಿಗೂ ಧನ್ಯವಾದಗಳನ್ನು ಹೇಳ್ತಾ, ಮತ್ತು ನಮ್ಮ ಇಂದಿನ ಅತಿಥಿಯನ್ನು ನಮಗೆ ಇಂಟ್ರೊಡ್ಯೂಸ್ ಮಾಡಿದಂತಹ ಜ್ಯೋತ್ಸ್ನಾ ಪ್ರಸಾದ್ ಹಾಗೂ ಗುರುಪ್ರಸಾದ್ ಅವರಿಗೆ ಅನಂತ ಧನ್ಯವಾದಗಳನ್ನು ಹೇಳ್ತಾ ನಿಮಗೆಲ್ಲರಿಗೂ ನಮ್ಮ ಈ ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ಮತ್ತೊಮ್ಮೆ ಸ್ವಾಗತವನ್ನು ಕೋರ್ತಾ ಇದ್ದೇನೆ. ನಾವು ನಮ್ಮ ಈ ಕಾರ್ಯಕ್ರಮದಲ್ಲಿ ಪ್ರತಿ ವಾರ ಹಲವಾರು ಹುದ್ದೆಗಳಿಂದ ಬೇರೆ ಬೇರೆ ಸಾಧಕರನ್ನು ಕರೆದು ಅವರೊಂದಿಗೆ ಸಂವಾದ ಮಾಡ್ತೇವೆ. ಏಕೆಂದರೆ ಇವರೆಲ್ಲರ ಸಾಧನೆ ನಮಗೆ ಸ್ಫೂರ್ತಿ. ಈ ಕನ್ನಡಿಗರ ಸಾಧನೆಯಿಂದ ನಾವು ಏನಾದರೂ ಕಲಿತು ನಮ್ಮ ಜೀವನದಲ್ಲೂ ಸಾಧನೆ ಮಾಡೋಣ ಅನ್ನೋದು ನಮ್ಮ ಒಂದು ಆಂಬಿಷನ್ ಅಂತ ಹೇಳ್ಬೋದು. ನಮ್ಮ ಇಂದಿನ ಅತಿಥಿಯಾದಂತಹ ಡಾಕ್ಟರ್ ಅನಿಲ್ ಪ್ರಸಾದ್ ಅವರ ಸಾಧನೆಯ ಪಟ್ಟಿಯನ್ನು ನಾನು ಹೇಳ್ತಾ ಹೋದರೆ ಇವರು ಕನ್ನಡಿಗರು ಅಂತ ಹೇಳಕ್ಕೆ ನನಗೆ ಬಹಳ ಹೆಮ್ಮೆ ಆಗುತ್ತೆ. ಇವರು ನಮ್ಮ ಇಂದಿನ ಈ ಹೆಲ್ತ್ ಸೀರೀಸ್ ಅಲ್ಲಿ ನಾವು ಮಾಡ್ತಿರೋಂತಹ ಅತಿಥಿಗಳಲ್ಲಿ ನಾವು ಡಾಕ್ಟರ್ಸ್ ಹಾಗೂ ಹೆಲ್ತ್ ಕೇರ್ ಇಂಡಸ್ಟ್ರಿ, ಮೆಡಿಕಲ್ ಇಂಡಸ್ಟ್ರಿ ಪ್ರೊಫೆಷನಲ್ ಇರುವಂತಹ ಸಾಧಕರನ್ನು ಕರೆದು ಒಂದು ಸೀರೀಸ್ ಮಾಡ್ತಾ ಇದ್ದೇವೆ. ಈ ಹೆಲ್ತ್ ಸೀರೀಸಲ್ಲಿ ಡಾಕ್ಟರ್ ಅನಿಲ್ ಅವರು ನಮ್ಮ ಮುಂದಿನ ಅತಿಥಿ. ಇವರು ಬಹಳನೇ ಒಂದು ಅಕಾಂಪ್ಲಿಷ್ಡ್ ಮೆಡಿಕಲ್ ಪಥಾಲಜಿಸ್ಟ್. ಇವರು ವರ್ಲ್ಡ್ ರಿನೌಂಡ್ ಅಂತಾನೆ ಹೇಳ್ಬೋದು. ಓವರ್ 60 peer reviewed ಪಬ್ಲಿಕೇಶನ್ಸ್ ಮಾಡಿದ್ದಾರೆ ಇವರು. ಪಬ್ಲಿಕೇಶನ್ಸ್ ಮತ್ತು ಹಲವಾರು ಕಾನ್ಫರೆನ್ಸಸ್ಗಳಲ್ಲಿ ಟಾಕ್ಸ್ನ ಕೊಟ್ಟು ಹಲವಾರು ಸಾಧನೆಗಳನ್ನು ಮಾಡ್ತಾ ಇವರು 20 ವರ್ಷಕ್ಕೂ ಹೆಚ್ಚು ಎಕ್ಸ್ಪೀರಿಯನ್ಸ್ ಇದೆ ಪಥಾಲಜಿ ಫೀಲ್ಡಲ್ಲಿ. ಇವರು ಇಂಡಿಯಾದಲ್ಲೇ ಬಹಳಷ್ಟು ಅಕಾಡೆಮಿಕ್ ಎಕ್ಸಲೆನ್ಸ್ನ ಸಾಧಿಸಿ ಅಲ್ಲಿಂದ ಅಮೆರಿಕಾಗೆ ಬಂದು ಇಲ್ಲಿ ಅವ್ರದ್ದೇ ಆದಂತಹ ಒಂದು ಕೆರಿಯರ್ನಲ್ಲಿ ಛಾಪನ್ನು ಮೂಡಿಸಿ ಇವರು ಅರ್ಲಿ ಅಡಾಪ್ಟರ್ ಆಫ್ ನ್ಯೂ ಟೆಕ್ನಾಲಜೀಸ್. ಅಂದರೆ ಈ ಪ್ಯಾಥಾಲಜಿಲಿ ಈಸ್ ಅ ವೆರಿ ಕಾಂಪ್ಲೆಕ್ಸ್ ಫೀಲ್ಡ್. ನಾವು ಈಗ ಈ ಸಂವಾದ ನಡೆಸ್ಕೊಂಡು ಹೋಗ್ತಾ ಇದ್ದಾಗ ಗೊತ್ತಾಗುತ್ತೆ ಹೇಗೆ ಇದು ಈ ಫೀಲ್ಡಲ್ಲಿ ಕಾಂಪ್ಲೆಕ್ಸಿಟೀಸ್ ಇರುತ್ತೆ, ಅದನ್ನ ಹೇಗೆ ಇವರು ಓವರ್ಕಮ್ ಮಾಡ್ತಾರೆ ಅಂತೆಲ್ಲ. ಬಟ್ ಈಸ್ ಅ ಅರ್ಲಿ ಅಡಾಪ್ಟರ್ ಟೆಕ್ನಾಲಜಿಲಿ. ಇವರು ಎತ್ತಿದ ಕೈ. ಹಾಗೂ ಇವರು ಅರಿಜೋನಾ ಡಯಾಗ್ನಾಸ್ಟಿಕ್ ಪ್ಯಾಥಾಲಜಿ ಅಸೋಸಿಯೇಟ್ಸ್ ಅಂತ ಅವ್ರದ್ದೇ ಒಂದು ಪ್ರೆಸಿಡೆಂಟ್ ಆಗಿದ್ದಾರೆ ಅಲ್ಲಿ. ಮತ್ತು ಇವರು ಅಸೋಸಿಯೇಟ್ ಪ್ರೊಫೆಸರ್ ಅಂಡ್ ಯೂನಿವರ್ಸಿಟಿ ಆಫ್ ಅರಿಜೋನಾ. ಸೊ ಹೆಲ್ತ್ ಕೇರ್ ಇಲ್ಲಿ ಇವರು ಫ್ಯಾಕಲ್ಟಿ ಮೆಂಬರ್ ಆಗಿ ಇವ್ರದೇ ಒಂದು ಫೆಲೋಶಿಪ್ ಪ್ರೋಗ್ರಾಮ್ ಕೂಡ ಮಾಡಿದ್ದಾರೆ. ನಾನು ಹೇಳ್ದಂಗೆ ಇವರ ಸಾಧನೆಯ ಪಟ್ಟಿಯನ್ನು ನಾನು ಲಿಸ್ಟ್ ಮಾಡ್ತಾ ಹೋದ್ರೆ ಐ ಫೀಲ್ ಹಿ ಈಸ್ ಒನ್ ಆಫ್ ದ ಮೋಸ್ಟ್ ಅಕಾಂಪ್ಲಿಷ್ಡ್ ಪರ್ಸನ್ ಐ ಹ್ಯಾವ್ ಎವರ್ ಇಂಟರ್ವ್ಯೂಡ್ on this program. So Dr. Anil Avre, thank you so much for taking the time and welcome to Bengaluru Voice.
Thank you. Namaskara Devdatta Avre, and thank you to all the team members of Bengaluru Voice. Really an honor nange illi irakke. Thank you.
Thank you, sir. So like now before we jump into your career, ನಿಮ್ಮ early achievements ಅದೆಲ್ಲ ನಾವು we'll cover in depth. But ಅದಕ್ಕೆ ಮುಂಚೆ first question is ನಮ್ಮ ಕೇಳುಗರಿಗೆ, what is pathology and how does it fit into our medical journey? Like as a normal non-medical person, pathology andre ಏನು, how does it fit in our lives?
Sure. Pathology subject to it is actually the study of the basis of disease ಅಂತಾರೆ. ಅಂದ್ರೆ ಡಿಸೀಸ್ ಯಾಕಾಗತ್ತೆ, ಥರ ಡಿಸೀಸು ಏನಕ್ಕಾಗತ್ತೆ, ಹೆಂಗೆ ಪೇಷಂಟ್ಸು ಮ್ಯಾನಿಫೆಸ್ಟ್ ಮಾಡ್ತಾರೆ ಅದೆಲ್ಲ ಪೆಥಾಲಜಿಲಿ ಬರುತ್ತೆ. ಸೊ ಬೇಸಿಕ್ಲಿ ಇಟ್ ಈಸ್ ದ ಸ್ಟಡಿ ಆಫ್ ಹ್ಯೂಮನ್ ಡಿಸೀಸ್ ಅನ್ಬೋದು. ಆ್ಯಂಡ್ ಎಲ್ಲ ಡಿಸೀಸಸ್ಸು ಹೆಂಗೆ ಮ್ಯಾನಿಫೆಸ್ಟ್ ಆಗುತ್ತೆ ಅದರದ್ದು there is a basis in the body, the reactions in the body, and those reactions within the cell, within the tissue that is what causes disease, right? In the
Yes.
blood, blood is also a tissue. So whether it is blood or any other tissue, lung, whatever is happening, so the study of that tissue is pathology. um, and we study that tissue. Basically it's cells, a collection of cells is tissue, and those are so microscopic. So adake we need a microscope. So most of the time my work is through the microscope, studying the cells and tissue or the blood, and based on that, uh, we give a diagnosis. And our diagnosis ಮೂಲಕ ಫಿಸಿಷಿಯನ್ಸು ಟ್ರೀಟ್ ಮಾಡ್ತಾರೆ.
So physicians, whenever they have so nimge they send tissue samples, and then like, do they have some idea of what could be wrong, or like, do you start from zero and find out what is wrong?
ಸ್ವಲ್ಪ ಐಡಿಯಾ ಇರುತ್ತೆ ಅವ್ರಿಗೆ. ಫಾರ್ ಎಕ್ಸಾಂಪಲ್, ಇವಾಗ ಪೇಷಂಟ್ ಕಮ್ಸ್ ವಿತ್ ಕಾಫ್ ಅಂಡ್ ಬ್ರೆತ್ಲೆಸ್ನೆಸ್ ಅಂದ್ರೆ ದೇ ವಿಲ್ ಡೂ ಸಮಥಿಂಗ್ ವಿತ್ ದ ಲಂಗ್ ಆರ್ ದ ಹಾರ್ಟ್ ಅಲ್ವಾ. ಹಾಗೆ ಹೊಟ್ಟೆ ನೋವು ಆದ್ರೆ ದೇ ವಿಲ್ ಥಿಂಕ್ ಅಬೌಟ್ ವೆದರ್ ದೇರ್ ಇಸ್ ಸಮಥಿಂಗ್ ಗೋಯಿಂಗ್ ಆನ್ ಇನ್ ದ ಸ್ಟಮಕ್ or the GI tract, food pipe in the head to stomach all the way to the colon. So they will probably do a biopsy because the patient symptoms are related to stomach or intestine, like indigestion or diarrhea or whatever it is. But they don't know what is happening within. So ಅದಕ್ಕೇನೆ ಅವರು biopsy ಮಾಡ್ತಾರೆ, and ನಂಗೆ ಬರುತ್ತೆ ಆ ಟಿಶ್ಯೂ. ನಾವು ಪ್ರಾಸೆಸ್ ಮಾಡಿಬಿಟ್ಟು ಆ ಟಿಶ್ಯೂನ ಮೈಕ್ರೋಸ್ಕೋಪಲ್ಲಿ ನೋಡ್ಬಿಟ್ಟು we can tell whether there is some cancer there, or is it some worm infestation, or some blood disease, or less blood supply. ಆ ಥರದ್ದೆಲ್ಲ ಮೈಕ್ರೋಸ್ಕೋಪ್ ಥ್ರೂ ನೋಡ್ಬಿಟ್ಟು ನಾವು ಆ ಡಯಾಗ್ನೋಸಿಸ್ ಕೊಡ್ಬೋದು.
Very interesting. So, sir, you've had a distinguished academic career in India, and then you've even earned the top rank in your MD exam. That was very impressive to see. ತಮಗೆ ಇದರಲ್ಲಿ pathology, how did you get interested in it? Because like ನೀವು starting from your early from your masters, you've been focused on pathology. ಹೇಗೆ, how did you get this spark? What inspired you to pick up this field?
That is actually serendipity. I had some interest in pathology in medical school. Pathology is taught in second year of medical school. ಅಲ್ಲಿ ಏನಾಯ್ತು ಅಂದ್ರೆ, ನಮ್ಮ ಪ್ರೊಫೆಸರ್ ಒಬ್ರು ಇದ್ರು, ಮೇಜರ್ ಜನರಲ್ CSV ಸುಬ್ರಹ್ಮಣ್ಯಂ, ಆರ್ಮ್ ಫೋರ್ಸಸ್ ಮೆಡಿಕಲ್ ಕಾಲೇಜ್ ಪೂನಾಲಿ. ಅವರು was a great teacher, and sometimes that is what a student needs to be interested in any field, alva. Some inspiration from some great teachers who teach with passion. So he was one of those teachers who really put so much effort in inspiring us students. So adon background ittu. Adagmele nange pathology is, you see, I'm a people's person anbodu. I interact a lot with patient, with people and patients. So nanu pathology nodre, it's almost like someone who likes solitude. They want to be in the lab. We are often called lab rats because we hardly interact with patients much. Martivi, but only to do procedures, biopsy procedures. So nan ankonta idde, nan henge, how can I spend life just peering through the microscope all along anta. And so in fact, truth be said, nan madlu I was thinking of internal medicine and cardiology. But it so happened, entrance exams irutte India li, the all India entrance exams to get into postgraduate. ನಾನು ನಂಗೆ ಫಸ್ಟ್ ಚಾಯ್ಸ್ ಸಿಗಲ್ಲ ಅನ್ಕೊಂಡು, ಈ ಪ್ರೀಮಿಯರ್ ಇನ್ಸ್ಟಿಟ್ಯೂಷನ್ಸ್ ಅಲ್ಲಿ ಸಿಗಲ್ಲ ಅನ್ಬಿಟ್ಟು, ಫಸ್ಟ್ ಚಾಯ್ಸ್ ನಾನು ಇದು ಇದು ಇಂಟರ್ನಲ್ ಮೆಡಿಸಿನ್ ಹಾಕಿದ್ದೆ. ಆಮೇಲೆ ಪೆಥಾಲಜಿನ ಸೆಕೆಂಡ್ ಚಾಯ್ಸ್ ಹಾಕಿದ್ದೆ. ಹಂಗೆ ಆಯ್ತು, ಫಸ್ಟ್ ಚಾಯ್ಸ್ ಸಿಗ್ಲಿಲ್ಲ, ಸೆಕೆಂಡ್ ಚಾಯ್ಸ್ ಸಿಕ್ತು. ಓಕೆ, ಅಂಡ್ ದಟ್ಸ್ ಹೌ ಐ ಗಾಟ್ ಇನ್. ಬಟ್ very my good fortune that pathology ನಾನು ಜಿಪ್ಮರಲ್ಲಿ ಮಾಡಿದ್ದು ಪಾಂಡಿಚೇರಿ. ಪಾಂಡಿಚೇರಿ ಜಿಪ್ಮರಲ್ಲಿ I was very fortunate to have some very good teachers and very good colleagues, my peers. Our the interaction in the I was very interested in this subject. Uh, that's how I started my life in pathology.
Okay, so yeah, definitely ನಿಮ್ಗೆ after the serendipitous push and also with great teachers and mentors mixed
Yes,
with your hard work, you topped the
yes,
college.
of course. Yeah, that a lot of luck, and it's God's grace and ಅಷ್ಟೇ.
Yeah, definitely. It's like we should say you're too humble, but we'll definitely learn from
Thank
that.
you.
It's very inspiring to see you after being so accomplished, being so down to earth. So, Tao, you transitioned from India to US for further training, and then after you finished your MD, you topped the exams, and from there you decided to move to the US. And I think this was in early 80s, sorry, mid 80s. So
Yeah.
ಹೇಗಿತ್ತು? It's been a long time. The US we see today is very different from the US you saw. ಹೇಗಿತ್ತು
Mhm.
ನಿಮ್ದು transition, and also what sparked that journey for you?
Mhm. Yeah, just a small correction. Actually, I moved in 96.
Okay, sorry.
1996 is when I moved. No
Okay.
problem. So 1996 ಅಲ್ಲಿ ಏನಾಗ್ತಾ ಇತ್ತು ಅಂದ್ರೆ, even though there were premier institutions in India, so-called central government institutions, JIPMER, AIMS, Delhi, PGI, Chandigarh, ಸ್ವಲ್ಪ ಲಿಮಿಟೇಷನ್ಸ್ ಇತ್ತು ನಮಗೆ ಟೆಕ್ನಾಲಜಿ ವೈಸ್. ಅಂದ್ರೆ ಪುಸ್ತಕದಲ್ಲಿ ವಿ ನಾವು ಪುಸ್ತಕಗಳು ಓದಿದ್ದೆಲ್ಲ ಇಟ್ಸ್ ಆಲ್ ಬ್ರಿಟಿಷ್ ಟೆಕ್ಸ್ಟ್ ಬುಕ್ಸ್ ಅಂಡ್ ಅಮೆರಿಕನ್ ಟೆಕ್ಸ್ಟ್ ಬುಕ್ಸ್, ಥಿಯರಿ ಅಂಡ್ ಆಲ್ ದ್ಯಾಟ್. ಮೆಡಿಸಿನ್ ಅಲ್ಲಿ ಓದೋದು, ಮೆಡಿಕಲ್ ಸ್ಕೂಲಲ್ಲಿ ಓದೋದು. ಆ ಬುಕ್ಸ್ ಅಲ್ಲಿ ನಾವು ಕಲ್ತಿದ್ದು ಪಾಠಗಳೆಲ್ಲ, there was a lot of theory, but when it came to practicing, we were lacking in certain technology, especially pathology. It's we are dependent a lot on equipment, you know. Um, so that became a little bit of a hindrance, to further in our subject. You know, um, we made all these great diagnoses, but treatment was limited. ಯಾಕೆಂದ್ರೆ they were not enough drugs, state of art technology ಇಲ್ದೇ ಇರೋಕೆ the industry was lagging behind ಅವಾಗ at that time. Even diagnostic equipment manufacturers, we had to depend a lot on testing kits from abroad. So that was a limitation, and I wanted that hands-on experience using state-of-art equipment. And that yearning was one reason why I wanted to move to the United States. The second reason was very plain and simple. All my peers, some of my friends who were in JIPMER and elsewhere in FMC at that time in the late 1990s or mid 1990s, they were all had opportunities. They were moving, and they were talking about how they're very satisfied with what they were doing in the hospitals. Uh, when your friends are gone, you want to be with your friends, you want to follow them, and you want to interact with them. So I will not diminish that factor. Besides the yearning to learn more about the subject, it was also to be with my peers.
Yeah,
So
friends like us.
that's what made me move to the
Awesome.
US.
Yeah, that
And let me tell you, I never knew that I would stay in the US for long. I thought training ಮಾಡ್ಕೊಂಡು ಎಲ್ಲ ಕಲ್ತ್ಕೊಂಡು ವಾಪಸ್ ಬರೋಣ ಅನ್ಕೊಂಡಿದ್ದೆ ನಾನು, ಬಿಕಾಸ್ ನಮ್ಮ ಪೇರೆಂಟ್ಸ್ ಇಲ್ಲೇ ಇದ್ರು ಬೆಂಗಳೂರಲ್ಲಿ, ಅಂಡ್ ಮೈ ಬ್ರದರ್ ಇಸ್ ಆಲ್ರೆಡಿ ದೇರ್ ಇನ್ ದ ಯುನೈಟೆಡ್ ಸ್ಟೇಟ್ಸ್. ಸೊ ನಾವಿಬ್ರೇ ಮಕ್ಕಳು. ಸೊ ಐ ವಾಂಟೆಡ್ ಟು ಕಮ್ ಬ್ಯಾಕ್, ಅಂಡ್ the honest answer to that is that, when you are getting used to this technology and all the beautiful things that you experience in your profession mainly, Socially, yes, to a certain extent, right? Life is great, the freeways and whatever, things are, the air conditioning or nice cars or whatever it is. That was not a big factor. But what is important is that when you're so, anything you think of, the sky is literally the limit. USLE, there's so many opportunities for professionals in all fields, right? That uh, was certainly a big pullback for me. And when I went to India, 2001 ali, Y2K ಆಗಿತ್ತು, 2000 actually I went, and I still found that the conditions had not improved as much compared to 1995 and 96 when I left. And that, to my disappointment, and much to the disappointment of my parents, I decided to stay back.
Oh, I think in the same vein, I mean, Iga, I know you're in Bangalore right now. So,
Yes.
Iga, how do you feel in the past 24 years, India, how do you feel the healthcare system has evolved? And especially because India, the population faces a lot of chronic ailments like diabetes and related health issues because of that. And
Yes.
India, obviously, there's like a healthcare revolution as well. What do you feel about the country's infrastructure these days?
I think if I were to answer in one sentence, Devdattare, I would say that if it were now, I would never have moved to the US, because the infrastructure in India is just fantastic. I know I can talk about healthcare, and I'm sure it's the same in all other fields. Uh, we are at level with a lot of the healthcare delivery systems in the US and UK. Facilities here are fantastic. ನಾನು ಈಗ ತಾನೇ ನನ್ನ ಇನ್ಸ್ಟಿಟ್ಯೂಷನ್ ಇಂದ ಬಂದೆ, ಜಿಪ್ಮರಲ್ಲಿ ಹೋಗಿದ್ದೆ 3 days ago, and I was bowled over by the change, the technology, and even the caliber of the students. So hunger, enthusiasm, the curiosity, ಅದನ್ನೆಲ್ಲ, it is, I was just thrilled beyond words. And ಖಂಡಿತ ನಾನು ಇವಾಗ ಏನಾರ if I have to start out now, no, I would never have gone to the US.
Yeah, awesome.
Yes.
So Learning Cube Academy, ಅವರು ಹೇಳ್ತಾರೆ, I don't know his real name, but ಅವರು ಹೇಳ್ತಾರೆ, awesome to see you, Anil. Anil is one of the kindest person and so helpful to everyone. And he's like I said, we have a live stream, so somebody did a
Oh,
live.
okay. Okay.
ಗಿರಿಧರ ಜಿ ಅವ್ರು
Thanks for
ಹೇಳ್ತಾ
those
ಇದ್ದಾರೆ,
kind words. Yeah.
ಗಿರಿಧರ ಜಿ ಅವ್ರು ಹೇಳ್ತಾ ಇದ್ದಾರೆ, ಗ್ರೇಟ್ ಡಾಕ್ಟರ್ ಆರ್ಟಿಕ್ಯುಲೇಟಿಂಗ್ ಸೋ ವೆಲ್ ಅಂತ ಇದ್ದಾರೆ. So thank you for that insight.
Take
So
care.
next question, I wanted to cover some of this together with your in the technological. As you look at pathology, we talked about how you established the first FNAC clinic, and maybe if you can help us understand how your field is evolving in the increasing role of AI in your field. Actually, even one of our live listeners, Varun ಅವರು ಕೇಳ್ತಾ ಇದ್ದಾರೆ, ವರುಣ್ ಗಿರಿಧರ್ ಅವರು. Do you see a increasing role of AI, artificial intelligence in medical pathology, especially because you just said a lot of the work comes from looking at microscopal image ನೋಡಿ to derive what's going on.
ಹೌದು.
So like ChatGPT and Google Gemini, there's like a really popular demo where they give the AI model 2 mammograms and it can find
Yes.
cancerous tissue several weeks ahead in the present state of AI. So Nimd, how is it affecting your field, and how are you guys using it?
Mm-hmm. Yeah, Kandita, AI is touching all fields of medicine, and especially pathology. Um, Pathologically, there are two aspects to it. Okay, pathologically, there is the production of tissue, right? The tissue has to be, there's an organ which is removed. Say part of the brain is removed. That brain needs to be sliced into small sections and very thin sections of 4 microns, which needs to go on a glass slide. And then we looked under the microscope. ಆವಾಗಲೇ ನಮಗೆ ಅದು ಚೆನ್ನಾಗಿ ಕಾಣಿಸುತ್ತೆ. So that is the technological part. One of the technologies that we use, cutting the tissue. The second aspect of pathology work ಏನು ಅಂದ್ರೆ ನಮ್ದು ಕಣ್ಣಿಂದ ನೋಡಿ ಇಂಟರ್ಪ್ರೆಟ್ ಮಾಡೋದು. The tissue which has some designs, we see what the tissue is doing, how does it look, right? So a lot of it is pattern recognition, um, and so in fact healthcare ಅಲ್ಲಿ radiology spearheaded the introduction of robotics and AI yoga, ನೀವು ಹೇಳ್ದಂಗೆ mammogram ಅಲ್ಲಿ. So thousands of mammograms were fed to the AI systems, and the radiologists um, were they have been their work has really been facilitated by AI, where AI screens out all the negative mammograms and leaves the positive ones for the radiologist to interpret. Just because of the pattern, the AI has been taught what are the negative mammograms, just the bulk of data. Hage pathology, there are certain cancers which is purely based on pattern, the grade of the cancer, even to say whether there is cancer or not, is purely based on patterns on the tissue. And so these slides, which have these patterns, were digitized. Digitized andre, the images were put onto, they were scanned, and there is a scanner, the computer really, thousands of images were put in. And then they were fed into, AI algorithms. And you will be surprised to know that prostate cancer, there's an entity, right? Prostate, there's a lot of old people get cancer, prostate cancer, men get prostate cancer. Prostate cancer, it's all based on design, on patterns. And AI today is able to diagnose whether there is cancer or not based on the patterns. So that is one area where they're able to help the pathologist. So many of the pathologists, their throughput has increased, right? Because AI is able to screen and put some dots and say that, hey, look at this case more carefully because they think there is cancer, right? So the pathologist spends more time on those slides which may have cancer. So throughput of pathologists has increased. The second way AI has made a big impact is basically with technology, with the instrumentation. Instruments, so now we need high throughput scanners, and then the images are put into a scanner al hakirtare, and the algorithms, so they can actually interpret, score, events. Sometimes we are looking at genetic events within the nucleus of a cell. So if there are a lot of chromosomes, it means it could be precancerous, or there is loss of chromosomes, and these chromosomes are all tagged with dyes, and this AI algorithm can make sense out of the number of dyes, loss of dyes, colors, and hagagi because of the, I would say there is a perfect convergence of robotics and AI happening today. At least I can say what I see in my lab, and what I would say physical intelligence antarala hage. That is the aim today, according to many AI pioneers. Nimge gottirbeku, they're Daniel R and all that, head of MIT pioneers. They're talking about that, and certainly that technology namge patients care, it cuts down the time we give the diagnosis. Madlala diagnosis kodake, I would take about 14 hours, 14 to 16 hours. Ivaga nanu I can give in 4 hours.
Wow.
Because of the high throughput.
Wow. There's a saying, AI is not going to replace you, but like somebody who's using AI is going to replace you ಅಂತ ಹೇಳ್ತಾ ಇರ್ತಾರೆ ಅಂದ್ರೆ because like if you people like you are already so good in your field and you're using AI and your throughput is dramatically increasing. So so we have a related question live stream ಅಲ್ಲಿ ಕೇಳ್ತಾ ಇದ್ದಾರೆ. So current AI is machine assisted and human generated ಅಂದ್ರೆ like you're the leader, the human is still the leader and the machine is assisting you ಅಲ್ವಾ? So do you
ಹೌದು.
feel that it's going to flip where AI is going to do the lead and humans going to assist?
I don't think so. I don't think so. There is a long way to go for AI to be controlling. So what AI youth in Dina AI is still restricted to a 2D environment. It's within the computer. Correct me if I'm wrong. Nange ಗೊತ್ತಿರೋಂಗೆ ನಿಮ್ಮ field AI ಅಲ್ಲಿ. And ನಾವು robotics ತೊಂತಾ ಇದೀವಿ. Robotics, we have a robot, but that has a finite intelligence. Whatever it has been programmed, a robot ಮಾಡುತ್ತೆ. ನಾವು ರೋಬೋಟ್ಗೆ ಏನಾರ ಜಾಸ್ತಿ ಹೇಳ್ಕೊಟ್ರೆ ಆ ರೋಬೋಟ್ ಮಾಡುತ್ತೆ. And of course, AI now we have to keep on feeding data. So nuances are nuances of life, gray areas of life. Life is not black and white, Allah. Gray areas idde irutte. ಆ ಗ್ರೇ ಏರಿಯಾಸ್ನ ಟೀಚ್ ಮಾಡೋಕ್ಕೆ ಮೆಷಿನ್ಗೆ ಸ್ವಲ್ಪ ಟೈಮ್ ತಗೊಳುತ್ತೆ. But definitely it will come close to where they could be doing a lot of interactions. Human to machine interactions are going to be is going to probably be the norm. And I think machines will start understanding human language. ನಂಗೆ ಅನ್ಸುತ್ತೆ.
Awesome. So I'll just want to share one final comment from Krishna Nayangar, and then we'll head for a small break. ಅವ್ರು ಹೇಳ್ತಾ ಇದ್ದಾರೆ, Krishna Nayangar, I was Anil's colleague in Jipmer before he left for the US. So I can say with certainty, he was one of the smartest brains among us, highly empathetic, concerned for both patients and colleagues. So great praise for you.
Oh, that I am overwhelmed with emotion for Krishnan to say such great things. And ಯಾರು ಹೇಳ್ಬೋದು, I have recruited all these people. Actually, Giridhara, whom you heard, is my uncle.
Okay.
So hats off to him. So there is some amount of nepotism going on here.
Yeah, we wouldn't know until you tell us. So Guru Prasad ಅವರು ಹೇಳ್ತಾ ಇದ್ದಾರೆ, I had the pleasure of growing up with Anil. More than a doctor, he's an amazing human being, and the number of lives he has touched is countless. Patience is his true virtue ಅಂತ ಹೇಳ್ತಾ ಇದ್ದಾರೆ.
My God. Again, he's my cousin. He is going to tell good things only. But
My cousins don't say anything like that. So
ಒಂದೇನು ಅಂದ್ರೆ, yes, I have had the good fortune ಒಂಥರ ಹೋಲಿಸ್ಟಿಕ್ ಮೆಡಿಸಿನ್ ಇಂಡಿಯಾಲ್ ಕಲ್ತ್ಕೊಂಡಿದ್ದಕ್ಕೆ I'm not just restricted to pathology. ಸ್ವಲ್ಪ ಮೆಡಿಸಿನ್ ವಿಷಯ, ಸರ್ಜರಿ ವಿಷಯ, ಆಂಕಾಲಜಿ, ಎವ್ರಿಥಿಂಗ್ ಸ್ವಲ್ಪ ಬರುತ್ತೆ. ಡರ್ಮಟಾಲಜಿ, ಬಿಕಾಸ್ ಆ ಥರ ಬ್ರಾಡ್ ಟ್ರೈನಿಂಗ್ ಇತ್ತು ಇಂಡಿಯಾಲಿ. ಸೊ ಒಂದೊಂದ್ಸಲಿ ಹೆದರಿಕೆ ಆಗತ್ತೆ. Guru's friends and a lot of the people, patients, especially from your Bay Area, by the way. I had a lot of patients consulting me. Questions ಕೇಳ್ತಾರೆ ನನಗೆ, ಒಂದೊಂದ್ಸಲಿ ಅನ್ಸುತ್ತೆ I hope I'm advising them correctly ಅಂತ. But also ನಾನು ಒಂದು ಹೇಳ್ತೀನಿ, ಐ ಆಮ್ ವೆರಿ ಫಾರ್ಚುನೇಟ್ ಟು ಹ್ಯಾವ್ ವೆರಿ ಗುಡ್ ಕಾಲೀಗ್ಸ್. ನನಗೆ ಆಂಕಾಲಜಿಸ್ಟು, ಪ್ಲಾಸ್ಟಿಕ್ ಸರ್ಜನ್ಸ್, ಎಲ್ಲರೂ ಇದ್ದಾರೆ by virtue of being in the hospital, and they are readily available, especially ನಾನೇನಾರ ಕೇಳಿದ್ರೆ. ಸೊ ನಂಗೆ ಏನಾರ ಗೊತ್ತಿಲ್ಲದ್ರೆ ಕ್ವಿಕ್ಲಿ I cheat. I get their input, and sometimes I directly hook my oncologist friend to the patients. So it's wonderful, all we doctors, we want to allay the anxiety and fears of patients. So hospital environment, especially US ಅಲ್ಲಿ ಇವಾಗ ಒಂಥರ ಕಷ್ಟ ಆಗೋಗಿದೆ. ಶಾರ್ಟ್ ಟೈಮು, ಡಾಕ್ಟರ್ಸ್ಗೆ ಜಾಸ್ತಿ ಟೈಮ್ ಸಿಗಲ್ಲ. And patients need they have a lot of unanswered questions, let me put it that way. And ಈ ಥರ, especially through this your forum, Bangalore Voice and other things that Guru Prasad and your friends, you people in Bay Area are doing, I think that will help. I think ನಾವು ಸುಮ್ಮನೆ ಈ ಥರ ಕನ್ಸಲ್ಟೇಷನ್ my oncology friends, a lot of even the American guys, they love to come, even if it is evening. They want to give a consult, telephonic consult, free consults, because they are seeing that need for
Yeah.
patients.
Yeah, definitely. When I was doing research about this, about you for this episode, that was the resounding thing I heard. They were saying, ಏನಾದ್ರು ನಿಮಗೆ ಕಷ್ಟ ಇದ್ರೆ, if you ping Anil, Dr. Anil, he'll go out of his way to help you ಅಂತ. So thank you so much for everything that you've done.
Thank you.
ಜೀವನ ನಿಲ್ಕುಂಡ್ ಅವ್ರು ಹೇಳ್ತಾ ಇದ್ದಾರೆ, ಗ್ರೇಟ್ ಟು ಲಿಸನ್ ಟು ಯು ಅಂತ ಇದ್ದಾರೆ. ಸೊ ಯಾ, ಐ ಥಿಂಕ್ ಲೈಕ್ ದಿಸ್ ಹಸ್ ಬಿನ್ ಲೈಕ್ ಎ ವೆರಿ, ಆಸ್ ಯು ಕ್ಯಾನ್ ಸಿ, ಎಲ್ಲರೂ ಕಮೆಂಟ್ಸ್ ಹಾಕ್ತಾ ಇದ್ದಾರೆ. ಇಟ್ಸ್ ಸೊ, ಪೀಪಲ್ ಆರ್ ಸೋ ಇಂಪ್ರೆಸ್ಡ್ ಅಂಡ್ ಥ್ಯಾಂಕ್ಫುಲ್ ಫಾರ್ ಆಲ್ ದಿ ಹೆಲ್ಪ್ ಅಂಡ್ ಸರ್ವಿಸ್ ದಟ್ ಯು ಡನ್. ಸೊ we'll continue this great conversation after just a short 5-minute break. We'll come back and Anil ಅವರು, he has a long list of achievements. Really, we'll cover a few other sections when we're right back.
Tax, the leading tax consultant in the Bay Area. Prasanna Kumar ಅವರು ಯಾರಿಗೆ ತಾನೇ ಗೊತ್ತಿಲ್ಲ, ಬೇ ಏರಿಯಾದ ಪ್ರೊಫೆಷನಲ್ ಟ್ಯಾಕ್ಸ್ ಕನ್ಸಲ್ಟೆಂಟ್. ಟ್ಯಾಕ್ಸ್ ಫೈಲಿಂಗ್, ಟ್ಯಾಕ್ಸ್ ಪ್ರಿಪರೇಷನ್, ಅಕೌಂಟಿಂಗ್, ಪ್ಲಾನಿಂಗ್, ಬುಕ್ ಕೀಪಿಂಗ್ ಸರ್ವಿಸಸ್ ಫಾರ್ ಇಂಡಿವಿಜುವಲ್ ಅಥವಾ ಸ್ಮಾಲ್ ಬಿಸ್ನೆಸ್. ಯಾವುದೇ ಥರದ ಟ್ಯಾಕ್ಸ್ ಕನ್ಸಲ್ಟೆಂಟ್ ಪ್ರಶ್ನೆಗೆ ಯು ಕ್ಯಾನ್ ರೀಚ್ ಪ್ರಸನ್ನ ಕುಮಾರ್ at 408-222-0259. ಮೈಸೂರು ಶ್ರೀರಂಗ ಫಾರ್ ಆಲ್ ಯೋರ್ ಆಟೋಮೊಬೈಲ್ ಸರ್ವಿಸಸ್. 20 ವರ್ಷಗಳಿಂದಲೂ ಬೇರೆಯಲ್ಲಿ ಅತ್ಯುತ್ತಮ ಸರ್ವಿಸಸ್ನ ಕೊಡ್ತಿದ್ದಾರೆ. ನಿಮ್ಮ ವಾಹನದ ಆರೈಕೆಗೆ ಒನ್ ಆ್ಯಂಡ್ ಓನ್ಲಿ ಪರ್ಸನ್ ಶ್ರೀ ಆಟೋ ಸರ್ವಿಸಸ್. ಶ್ರೀ ಆಟೋ ಸರ್ವಿಸಸ್ ಫ್ರೀಮಾಂಟ್ನಲ್ಲಿದೆ. ಅವರ ಫೋನ್ ನಂಬರ್ 510-996-8404. ಇನ್ನೊಮ್ಮೆ 510-996-8404. ಅಮೇರಿಕಾದಲ್ಲಿ ಮನೆ ತಗೊಳ್ಬೇಕು ಅನ್ನೋದು ನಿಮ್ಮೆಲ್ಲರ ಡ್ರೀಮ್ ಅಲ್ವಾ? ಈ ಡ್ರೀಮ್ನ ಸಹಕಾರ ಮಾಡಕ್ಕೆ ಬಂದಿದ್ದಾರೆ ನಮ್ಮ ಗಿರೀಶ್ ಬ್ಯಾಂಗ್ಳೂರ್. ಎಸ್, ರಿಯಲ್ ಎಸ್ಟೇಟಲ್ಲಿ ಟಾಪ್ ನಾಚ್ ಸರ್ವಿಸ್ ಕೊಡ್ತಿರೋ ಗಿರೀಶ್ ಅವರು ನಮ್ಮ ಕನ್ನಡಿಗರೇ. ಕನ್ನಡದವರೇ ಆದ ಗಿರೀಶ್ ಜೊತೆ ರಿಯಲ್ ಎಸ್ಟೇಟ್ ಬಗ್ಗೆ ತಿಳ್ಕೊಳ್ಳೋಕ್ಕೆ ಬಹಳ ಚೆನ್ನಾಗಿರುತ್ತೆ. ಹೀ ಈಸ್ ಸೋ ನಾಲೆಜಬಲ್. ನನ್ನ ಪರ್ಸ್ನಲ್ ಎಕ್ಸ್ಪೀರಿಯನ್ಸ್, ರಿಯಲ್ ಎಸ್ಟೇಟ್ ಇನ್ ಆ್ಯಂಡ್ ಔಟ್ ಚೆನ್ನಾಗಿ ತಿಳ್ಕೊಂಡಿದ್ದಾರೆ. ಎಲ್ಲಿ ನಿಮ್ಮ ಡ್ರೀಮ್ ಹೌಸ್ ತಗೋಬೋದು, ಎಲ್ಲಿ ಇನ್ವೆಸ್ಟ್ ಮಾಡ್ಬೋದು, ಬೀಚ್ ಯೋರ್ ಫಸ್ಟ್ ಹೋಮ್ ಆರ್ ಯೋರ್ ಸೆಕೆಂಡ್ ಆರ್ ಮೆನಿ ಮೋರ್. ಫಾರ್ ರೀಚ್ ಔಟ್ ಗಿರೀಶ್ at 408-420-0646 ಅಥವಾ gbangalore@interroad.com. ಫೈನಾನ್ಷಿಯಲ್ ಫ್ರೀಡಮ್ ಯಾರಿಗೆ ತಾನೇ ಬೇಕಿಲ್ಲ? ಬಟ್ ಫೈನಾನ್ಷಿಯಲ್ಸ್ ಅಂದ ತಕ್ಷಣ ತಲೆನೋವು ಜಾಸ್ತಿ ಅಲ್ವಾ? ಡೋಂಟ್ ವರಿ, ಫಾರ್ ಆಲ್ ಯುವರ್ ಫೈನಾನ್ಷಿಯಲ್ ಕ್ವೆಶ್ಚನ್ಸ್, ಎಸ್, ಇನ್ವೆಸ್ಟ್ಮೆಂಟ್ ಇರ್ಬೋದು, 401k ರೋಲ್ ಓವರ್ ಇರ್ಬೋದು, ರಿಟೈರ್ಮೆಂಟ್ ಪ್ಲಾನ್, ಡೆಟ್ ಮ್ಯಾನೇಜ್ಮೆಂಟ್, ಎಜುಕೇಷನಲ್ ಸೇವಿಂಗ್ಸ್, ಫಿನಾನ್ಷಿಯಲ್ ಪ್ಲಾನಿಂಗ್, ಪ್ರೊಟೆಕ್ಷನ್, ಲೈಫ್, ಆಟೋ, ಹೋಮ್, ರೀಫೈನಾನ್ಸ್ ಆರ್ ಮಾರ್ಗೇಜ್ ಲೋನ್ಸ್, ಯಾವುದೇ ಇರ್ಬೋದು. ನಿಮ್ಮ ಎಲ್ಲ ಲೀಗಲ್ ಸಮಸ್ಯೆಗೆ ಪರಿಹಾರ ಬೇಕು ಅಂದರೆ ಎಸ್, ರೀಚ್ ಔಟ್ ಟು ಅನಿಲ್ ಹಾಲಪ್ಪ. ಹೌದು, ಅನಿಲ್ ಹಾಲಪ್ಪ ಅವರ ಮೊಬೈಲ್ ನಂಬರ್ 209-380-9858 ಅಥವಾ halappa@primerica.com. ನಮ್ಮ ಎಲ್ಲ ಸ್ಪಾನ್ಸರ್ಸ್ಗಳಿಗೂ ನಮ್ಮ ಬೆಂಗಳೂರು ವಾಯ್ಸ್ ಕಡೆಯಿಂದ ಒಂದು ಬಿಗ್ ಥ್ಯಾಂಕ್ ಯು.
ನಾವು ಇಂದಿನ ಈ ಸಂಚಿಕೆಯಲ್ಲಿ ಡಾಕ್ಟರ್ ಅನಿಲ್ ಅವ್ರ ಜೊತೆ ಸಂವಾದ ನಡೆಸ್ತಾ ಇದ್ದೇವೆ. ಬ್ರೇಕ್ಗೆ ಹೋಗಿದ್ದಾಗ ಒಂದು ಕಮೆಂಟ್ ಬಂತು, ಡಾಕ್ಟರ್ ಅನಿಲ್ ಹ್ಯಾಸ್ ಹೆಲ್ಪ್ ಮೀ ವಿತ್ ಮೈ ವೈಫ್ was diagnosed with cancer and I was bugging him with so many questions. He was answering all my silly questions with utmost patience. Thanks, doctor. We're proud of you. Thanks a lot.
Thank you. Thanks.
So,
I'm just we got to thank God that she's giving such wonderful comments. She's happy, So that's wonderful.
awesome. ಮತ್ತೆ we wanted to talk about ನಿಮ್ಮ ರಿಸರ್ಚ್ ಕೆರಿಯರ್. ನೀವು ಬಹಳಷ್ಟು ರಿಸರ್ಚ್ ಮಾಡಿದ್ದೀರಾ. I just saw in PubMed and other places you have more than 68 articles published, and also like you have so many conferences that you talk, and a lot of in the forefront of research. Chaitra Giridhar ಅವ್ರು ಕೇಳ್ತಾ ಇದ್ದಾರೆ, related to that, are we any closer to finding a cure for cancer in this lifetime?
Oh my God. Yeah. That's a $1 billion question. I think the answer to that is that we now Kandita ಬೇಕಾದಷ್ಟು ಕ್ಯಾನ್ಸರ್ಸ್ ನ ಕ್ಯೂರ್ ಮಾಡಕ್ಕೆ we are on the way. We are either 3/4 of the way, or we are already, um, especially breast cancer, testicular cancers. Um, we are, I can confidently say that we are almost there, curally, complete curable. But there are some cancers we are still struggling with, either because they are rare, or because I say that they're very smart, these cancers, some of them. Now, ಒಂದು pathway, some treatment pathway ತೊಂತೀವಿ, uh, surprisingly, amazingly, ಈ cancer cells is just like bacteria resistance develop ಮಾಡುತ್ತಲ್ಲ, ಟ್ರೀಟ್ಮೆಂಟ್ ಆಂಟಿಬಯೋಟಿಕ್ಸ್ಗೆ. ಹಾಗೆ ಈ ಕ್ಯಾನ್ಸರ್ಗಳು ಟ್ರೀಟ್ಮೆಂಟ್ ಕೊಡ್ತಾ ಇರೋವಾಗ್ಲೇ ಬದಲಾವಣೆ ಆಗುತ್ತೆ. ಕ್ಯಾನ್ಸರ್ ಸೆಲ್ it mutates to a different form, either aggressively becomes aggressive, or it just becomes resistant to treatment. So just when aha moment anta barutte namge, oh, we have treated something and patient is going to get cured, sometimes we see relapses. But definitely the way technology and AI is coming into play, to answer Chaitra's question, I think we are getting there. May not be for all cancers, but for maybe most of the common cancers, we'll be able to find cures for sure.
That's very encouraging to hear, Uday, especially when we hear about cancers mutating and taking lives of across the spectrum. Otherwise, it's not just like old people, young people, across the age
Okay.
group, people lose their lives, and we hear it quite often. So it's definitely very encouraging to hear. So Nan, I just now shared a comment saying Dr. Anil has helped me with my wife when she was diagnosed with cancer. Anta. That was from our ನಮ್ಮ teammate ಆದಂಥ ರವಿ ಪಂಗಾಲ್ ಅವರು. So he's especially thankful for what you did for him.
Oh, of course. My pleasure, and thank you. Thank you for your kind words.
LS Ram ಅವ್ರು ಹೇಳ್ತಾ ಇದ್ದಾರೆ, I was a classmate of Anil in college and we've remained buddies since then. Anil is one of the kindest souls, always helpful and very humble ಅಂತ ಹೇಳ್ತಾ ಇದ್ದಾರೆ.
Thank you.
And,
Thank you, Ram.
Thank you. Chaitra ಅವ್ರು ಹೇಳ್ತಾ ಇದ್ದಾರೆ, I agree with all the comments here. We can approach Anil with any questions about medicine. So, yeah, I think we can share Anil our, I mean, if you look him up in Google, you can find him, I believe, and then maybe you can reach out to him through one way or the other.
Always welcome. As much as I can help, I will.
Awesome. Next, I just wanted to focus on a little bit of my favorite topic, which is your entrepreneurial side. And then, like, you have you held different positions in different companies, and then also you've been in the academics as well. But I think, like, you after some time you've started your own practice. You've been the president of Arizona Diagnostic Pathology Associates. Hey, Gita, how was that journey? How did you decide to start your own practice? And what was what was the again the spark for you to do that?
That again, you see, ಅಲ್ಲೇನೋ ಮ್ಯಾನೇಜ್ಮೆಂಟ್ ಲ್ಯಾಂಗ್ವೇಜ್ ಅಲ್ಲಿ ನಿಮ್ಗೆ ಗೊತ್ತಿರ್ಬೋದು, ಅದೇನೋ ಹೇಳ್ತಾರೆ, ಯು ಟೆಂಡ್ ಟು ಪುಷ್ ದ ಇಕ್ವಿಲಿಬ್ರಿಯಂ ಅಂತಾರೆ. At some point of time in life, a lot of people do that. And I think I probably that happened to me ಅನ್ಸುತ್ತೆ. ಯಾಕೆಂದ್ರೆ ನಾನು ಹಾಸ್ಪಿಟಲ್ ಬೇಸ್ಡ್ ಪ್ರಾಕ್ಟೀಸ್ ಅಲ್ಲಿ ಇದ್ದೆ. ಹಾಸ್ಪಿಟಲ್ ಬೇಸ್ಡ್ ಪ್ರಾಕ್ಟೀಸ್ ಏನು ಅಂದ್ರೆ, we are a group of pathologists. We are contracted to the hospitals, and the hospital, they have their own lab. We don't control the lab. We don't control the lab ಕೆಲಸ ಮಾಡೋರು ಟೆಕ್ಸ್, lab techs they are employed by the hospital. So we cannot, ಅವ್ರಿಗೆ ಜಾಸ್ತಿ, we cannot, we can guide them, but when it comes to getting new equipment or getting good people, ಒಂದೊಂದ್ಸಲಿ ಕಷ್ಟ. Hospital administrators ಈ ನಡುವೆ ಈ ಹೆಲ್ತ್ ಕೇರ್ ಇಕಾನಮಿ, ಎಸ್ಪೆಷಲಿ US ಅಲ್ಲಿ ಹೆಂಗೆ ಇದೆ ಅಂದ್ರೆ, with all that is going on, the hospital CEOs are stressed out, and the last thing they need is a pathologist, medical director telling them ನಂಗೆ ಈ equipment ಬೇಕು ಅಂತ. ಆದ್ರೂ ನಾವು ಕಷ್ಟ ಪಡ್ತಾ ಇದೀವಿ, ಪೇಷಂಟ್ ಕೇರ್ಗೆ ಬೇಕಪ್ಪ ಇದು ಮಾಡ್ಲೇಬೇಕು, ಪಾಸ್ ಮಾಡಿ ಅಂತ, the buying of the equipment. Um, so that was getting to me, because I had full control ಇರ್ಲಿಲ್ಲ, right? Lab and quality and all ಸ್ವಲ್ಪ hindrance ಇತ್ತು. And ಅದೇ ನಾನು ಬಿಗ್ನಿಂಗ್ ಅಲ್ಲಿ ಹೇಳ್ದಂಗೆ ಒಂಥರ after doing that for 30 years, ಅನಿಸ್ತು I want a new challenge ಅಂತ. I'd been doing the same thing. Um, Unfortunately, too late in my life. I wish I had this epiphany much earlier in life. You know, uh, I would have more energy and ಅನ್ಸುತ್ತೆ ನಂಗೆ.
But like better late
ಒಂದೊಂದ್ಸಲಿ
than
ರೈಟ್ ಒಂದೊಂದ್ಸಲಿ ಅನ್ಸುತ್ತೆ ಏನ್ ಮಾಡ್ತಾ ಇದೀನಿ ಅಂತ. ಯಾಕೆಂದ್ರೆ to have your own business, so you have to think from A to Z, right? You're the president and janitor of the company. And ನಾನು I would not have started this if I didn't have the support of my wife, frankly. ನಾನು ಸುಮ್ಮನೆ ಕೇಳಿದೆ ಅವಳಿಗೆ ಒಂದಿನ, that what do you think of me leaving hospital job? And I thought she'll say, oh my God, what's going to happen? Where are we going to get a salary and all that? But surprisingly, she was very supportive, my wife Suma. And I really owe it to her for pushing me to and encouraging me to start the lab. So uh, yes, I will admit I have an entrepreneurial bone in me. ಅದು ಸ್ವಲ್ಪ ಇತ್ತು. And let me say that I did not want to die regretting that I didn't try.
yeah.
Yeah.
Awesome. But in that journey, ನೀವು like I know you said you started late, but like I position it as you're so full of life that even after accomplishing so much, you still have the drive to do something more. Again, it's very inspiring for us, and ನೀವು ಕನ್ನಡದವರು ಅಂತೆಲ್ಲ ಹೇಳ್ಕೊಳಕ್ ನಮ್ಗೆ ಬಹಳ ಹೆಮ್ಮೆ ಆಗುತ್ತೆ. ಬಟ್ ನಿಮ್ಗೆ how do you keep yourself motivated? ಅಂದ್ರೆ ನೀವು ಹೇಳ್ದಂಗೆನೆ you had a very well accomplished career, not easy, but like paycheck ಬರುತ್ತೆ ಆ ಥರ ಜಾಬ್ ಇತ್ತು, ಬಟ್ ಲೈಕ್ you pushed yourself to go to the next level. What is that keeps you motivated? ನಿಮ್ಮ ಒಳಗಡೆಯಿಂದ ಆ ಕಿಚ್ಚಿರುತ್ತಲ್ಲ, ಅದು how do you keep that on?
I think Dave, I think it is the every day is a beautiful challenge. Every day there are a lot of new things happening. I have to put out sometimes new fires, and that itself, the act of finding the problem, the cause of the problem, and trying to solve it is just beautiful. It's it may be a very small issue. Sometimes it's just a question of bad weather in the specimens being couriered from one place to the other to my lab. Does not happen, right? And then we have to look for an innovative way. That innovative, the chance to think innovatively, does keep me going. And our field is such that medicine field henge andre every day there is a beautiful thing that we are doing, right? We are saving lives, literally, making a diagnosis. I'm getting phone calls about a patient who, young, old, they are anxious or they want to leave the country and they want a diagnosis quickly. How can I do that to help that patient and the doctor? Some examples ಕೊಡ್ತಾ ಇದ್ದೀನಿ, but all these keeps me going, and I feel that I'm making a difference in patients' lives, number one. And number two, ನನ್ನ own gig ಇಂದ ಏನಾಗಿದೆ ಅಂದ್ರೆ I'm employing patients. I'm sorry, patients and people, my techs. ಅವರು they have families, right? And I am really treating them like my family and taking care of them. And so I've now I feel I'm responsible for so many mouths to feed, and that certainly is keeps you going and makes you feel good. charity for me begins at home, very small, you know. So if I can do that on a day-to-day basis, that's great for me.
So they say that like entrepreneurship is like riding a lion. You don't fall off of it, right? Because the lion will gonna eat you up.
Yes, yes, yes. How the? Yeah, well said.
So yeah,
Yeah.
thank you for that insight. Again, like very inspiring to hear you talk. Shubha Satish ಅವ್ರು ಹೇಳ್ತಾ ಇದ್ದಾರೆ Dr. Anil Prasad is the greatest person on earth, the best human being, and I'm proud that he's my bhava. So she's revealing her identity, but
Full of ನಾನು ಏನ್ ಹೇಳಿ, she's a big fan of mine from the very beginning. So yeah, no, thank you Shubha for those kind words. Appreciate.
so Ravi Pangal ಅವ್ರು ಕೇಳ್ತಾ ಇದ್ದಾರೆ getting appointment with a specialist is a long wait here in the US. Why is that shortage? Do we have less medical schools, or is getting residency and specializing is a challenge? What is the root cause for this? How do you think that gap can be reduced?
um I think it's the appointment issue is mainly because uh, it's not because of not that there are enough doctors antala. It's, I think there is a maldistribution of the doctors. um you know, India ಅಲ್ಲಿ ಹೇಗೆ ನಮ್ಗೆ ರೂರಲ್ ಅರ್ಬನ್ areas ಇದೆಯಲ್ಲ, and India faces this problem like any other country, and US too. US ಅಲ್ಲಿ doctors, so they don't want to, they want to work in certain cities, certain big cities, especially specialists. uh, appointment specialist ಜೊತೆಗೆ ಸಿಗೋದು ಕಷ್ಟ, ಯಾಕೆಂದ್ರೆ most of the specialists want to work in big hospitals where the infrastructure ತುಂಬಾ ಚೆನ್ನಾಗಿರೋದು, ಆಸ್ಪತ್ರೆಯಲ್ಲಿ big cities ಅಲ್ಲಿ. So even suburbs of the cities ಅಲ್ಲಿ specialists sigala. So because of the maldistribution of doctors is one thing. Secondly, ಏನಾಗೋಗಿದೆ ಅಂದ್ರೆ definitely Ravi's comment is probably more pertinent in this post-COVID era. Post-COVID era ಏನಾಗೋಗಿದೆ, ಜನಗಳು you know, even the front office staff, reliable front office staff ಅಪಾಯಿಂಟ್ಮೆಂಟ್ ತೊಗೊಂತಾರಲ್ಲ, ಯಾರು ತಗೊಂಡು ಎಲ್ಲ ಅವರೇ ಜಾಸ್ತಿ ಜನ ಇಲ್ಲ, ಕಷ್ಟ ಆಗೋಗಿದೆ ಹೈರಿಂಗ್ ಸಪೋರ್ಟ್ ಸ್ಟಾಫ್. ಸೊ ಇಟ್ಸ್ ನಾಟ್ ಓನ್ಲಿ ಅ ಲ್ಯಾಕ್ ಆಫ್ ಡಾಕ್ಟರ್ಸ್, ಐ ಥಿಂಕ್ ಇಟ್ಸ್ ಅ ಲ್ಯಾಕ್ ಆಫ್ ಸಪೋರ್ಟ್ ಸ್ಟಾಫ್. ಸಮಟೈಮ್ಸ್ ಡಾಕ್ಟರ್ಸ್ ಇದ್ದಾರೆ, ಬಟ್ ನರ್ಸಸ್, ಮೆಡಿಕಲ್ ಅಸಿಸ್ಟೆಂಟ್ಸ್ ಇಲ್ಲ, and that can lead to, you know, delay in care, certainly. So I think it's a combination of factors. Um, it's just not the lack. I don't think there is a real lack of doctors. In fact, I think there's a lot of doctors being produced. ಇವಾಗೆಲ್ಲ there are private institutions, so they are funding themselves, self-funded institutions are churning out a lot of doctors in various states. Um, but again, it's just this lack of skilled labor in all spheres that has been contributing to delayed healthcare ಅನ್ಸುತ್ತೆ ನಂಗೆ. And coupled with that, you know, insurance, the bane of insurance, right? Nam US ಅಲ್ಲಿ insurance companies, they force patients to go to certain doctors, certain primary care doctors ಗೆ ಹೋಗ್ಬೇಕು ಅಂತ. ಈ primary care doctors, they are swamped because there are not enough primary care doctors. In fact, to your point, yes, there is a lack of primary care doctors ಇವಾಗ. ಯಾಕೆಂದ್ರೆ ಅವರು ಫ್ರಸ್ಟ್ರೇಟ್ ಆಗ್ಬಿಟ್ಟು because of the overwork, based because of the insurance people making them overwork, and lack of infrastructure by lack of support staff illa. So combination of these factors, a lot of private practitioners, primary care doctors, family practice doctors, who are the first doctors of a patient see, they are going away. They're all joining hospitals and they're becoming hospitalists.
Oh, wow.
where they're rotating in the hospital. So that's a big gap we are going to face. Really big gap we're going to face. So it's a combination of factors: lack of skilled labor and this insurance, nuances of the insurance, right? So it makes it a vicious cycle. Nange.
Got it. Yeah, I think this is a very deep topic that we can
Howದು
we can go on a, a long discussion.
ಹೌದು
Yeah.
correct.
So, slightly unrelated question, Jeevana Nilkund ಅವ್ರು ಕೇಳ್ತಾ ಇದ್ದಾರೆ, what is the comparison of a pathologist in India versus that of in the USA?
Oh, a comparison of pathologists. Okay. Um, Comparing the pathology in the US and India, I think again, at the end of the day, US US medicine, we we go deep, deep into a patient's problem. Personalized care ಅಂತ ಬಂದ್ಬಿಟ್ಟಿದೆ ಇವಾಗ. Personalized medicine. ನಿಮ್ಗೆ ಕೇಳಿರ್ಬೋದು ನೀವು. It's precision medicine, personalized medicine is the name of the game now. Andre, we tailor the treatment to a particular patient. Two patients may have stomach cancer, but they're treated totally differently. Patient A with stomach cancer may not get the same drugs which or chemotherapeutic drugs or radiation which patient B stomach cancer gets. So it's highly personalized. That is one thing. So uh, technology is very necessary. And so for a pathology lab in the US, um, we have to spend a lot of our time and our resources to giving a complete answer to our clinicians. What I mean by that is, bari diagnosis of cancer madre, it is not sufficient anymore, USLA, for a pathologist. My oncologist asks me, ನಾನು ಕ್ಯಾನ್ಸರ್ ಅಂತ ಡಯಾಗ್ನೋಸಿಸ್ ಕೊಟ್ಟ ತಕ್ಷಣ next thing he asks, how aggressive it is. What should I do? Should I give radiation or chemotherapy? ನಂಗೆ ಕೇಳ್ತಾರೆ. So the pathologist is not only a diagnostician, or also he gives very valuable information on treatment. What lines of treatment to be used, whether to bring in a radiation oncologist or a chemotherapy guy, right? And also gives information on prognosis. How long will the patient live with this kind of cancer? That information sometimes, as a pathologist, I can give by doing certain tests on the tissue, and we call it biomarkers, ancillary testing, which is so very necessary. And unfortunately, again, it comes back to, in India, that constraint is there. One is patient affordability, right? They can't afford all these expensive tests. And even for pathology, excellent pathologists with wanting to put up a lab, they have limitations of acquiring state-of-art technology, expensive Indiali, and illu expensive. In fact, I think it is 10 times more expensive, but vidhi illa ಮಾಡಬೇಕು,
Yeah.
yeah.
Yeah, again, very deep insight. Thank you so much for that. So now I think we've almost run out of time. So I just want to ask you a couple of personal questions and then
Sure.
we'll call it a day. So
Okay.
when you look back at your journey, when you've gone through a lot, like one of the most, like like I said in the beginning, you're one of the most accomplished persons I've ever interviewed in this show. So you've achieved so much, but when you look back at your journey, what advice do you have for young professionals, Indians, ನಮ್ಮ ಗ್ಲೋಬಲ್ ಕನ್ನಡಿಗರು ನಮ್ಮ ಈ ಕಾರ್ಯಕ್ರಮನ ಪ್ರಪಂಚಾದ್ಯಂತ ಎಲ್ಲರೂ ನೋಡ್ತಾರೆ, ಕನ್ನಡಿಗರು ಅವರ ಮಕ್ಕಳಿಗೆ, young people who are aspiring to become get a career in medicine or pathology, what do you have any advice for them?
Definitely. I think the first thing is embark on a career which you're truly passionate about. Passion irbekappa to do this. Medicine as such is a long haul journey, and you truly have to have that passion for interest in that subject. And I'll have to do it. Sounds like a cliche, but truly you have to care. You have to care for the patient. You have to care for the other human being. Pathologically, it's very easy to lose track of the patient at the other side of the slide, because sometimes you're not interacting with patients. So non-residents always I say, remember that tissue, that jar of tissue or slide is someone's patient's, some patient, someone's mother, someone's brothers, so we got to treat it with respect, though we are sometimes like a lab rat working in the lab. um, uh, that should be the driving force, is to have that compassion irbeku uh, to to listen to people, just to listen. Sometimes when I was doing private either general practice before pathology, half the problems of a patient is gone just by my listening to him or her. And just that, with if you have that ounce of compassion, um, and listening, having that, that you want to do good, that you have to have that, um, that will to serve, another human being or human beings, a bunch of people. I think that is the key answer there. For many doctor who is fully satisfied with his or her profession, that satisfaction, ashte. It's
that
not about, at the end of the day, materialistic baratte hogate.
correct.
But the day I see a smile on my patients, or when they email me and say that, hey doc, hey, you were right on, and I got this treatment, and anta hang heldaga, my day is done. That's that's the beauty of our profession.
Awesome. Yeah, we just saw today in a short span now in this live interview, Nalane, we had so many people coming in and sharing their how you changed their lives, how you impacted their lives for the better, and how you made such a remarkable, not just a remarkable career, but you, because of your that human touch, you said, like you care about your profession, you've done a lot for everybody. So we're ಮತ್ತೆ I think at this point, this is the last question I had. So like, first of all, thank you so much. ನೀವು ಬೆಂಗಳೂರಲ್ಲಿ ಇದ್ಕೊಂಡು, even though you have a really short time before your next flight, you took the time to talk with us. Not just that, but like, you impacted so many lives, so many careers. You created your own fellowship programs. I don't know how many students have become, how many of your students have become their own accomplished career professionals. So I think you had ಅಮೇಸಿಂಗ್ ಇಂಪ್ಯಾಕ್ಟ್. ನೀವು ಕನ್ನಡಿಗರು ಅಂತ ಹೇಳ್ಕೊಳಕ್ ನನಗೆ ತುಂಬಾ ಹೆಮ್ಮೆ ಆಗುತ್ತೆ. ಸೊ ಐ ಥಿಂಕ್ ಅಟ್ ದಿಸ್ ಪಾಯಿಂಟ್ ಐ ಜಸ್ಟ್ ಲೈಕ್ ಲೀವ್ ಯು ಫಾರ್ ದ ಫೈನಲ್ ಥಾಟ್ಸ್ ಅಂಡ್ ದೆನ್ ಕ್ಲೋಸ್.
Thank you. No, I know. I think for all the people who are listening, just be true to yourself. At the end of the day, you have to answer your conscience, right? Whatever career you choose, whatever it is. And, there's no such thing as a small job or a big job. Everything is, and having that service mind. My own cousin Guru has, you may call it a mutual admiration society, but I admire his work. Him and Josna and all you guys, all you people, what you're doing, imparting this knowledge and sharing information for all the people who are listening, and other the younger generation. I think just be true to yourself. That's all I can say.
Awesome, very wise words. ಥ್ಯಾಂಕ್ ಯು ಸೋ ಮಚ್. ಮತ್ತೆ ನಿಮಗೆ ಮತ್ತು ಜ್ಯೋತ್ಸ್ನಾ ಅವ್ರಿಗೆ ಹಾಗೂ ಗುರು ಅವರಿಗೂ ತುಂಬಾ ಧನ್ಯವಾದಗಳು. ನಮಗೆ ಇಂತಹ ಒಂದು ಆಪರ್ಚುನಿಟಿ, ಡಾಕ್ಟರ್ ಅನಿಲ್ ಅವ್ರನ್ನ ಇಂಟರ್ವ್ಯೂ ಮಾಡೋಕೆ ಆಪರ್ಚುನಿಟಿ ನಮಗೆ ಕೊಟ್ಟಿದ್ದಕ್ಕೆ. ಮುಂದಿನ ವಾರ ಇದೇ ರೀತಿ ಮತ್ತೊಬ್ಬ ಸಾಧಕರನ್ನ ನಿಮ್ಮ ಮುಂದೆ ಕರ್ಕೊಂಡು ಬರ್ತೇವೆ. ಅಲ್ಲಿ ತನಕ ನಿಮ್ಮ ಮನಸ್ಸಿನಲ್ಲಿ ರಾರಾಜಿಸುತ್ತಿರಲಿ ಬೆಂಗಳೂರು ವಾಯ್ಸ್. Listen to your heart.
ಆಲಿಸು ಗೆಳೆಯನ ಹೃದಯದ ಮಾತೊಂದ, ಬಿಚ್ಚಿಡು ಬಚ್ಚಿಟ್ಟ ಮನದ ಕನಸೊಂದ. ಹಿಂದೆ ಸಮಯ ಮುಂದೆ ಇಡಲು ನಮ್ಮ ಹೆಜ್ಜೆಯ ನಿನ್ನ ಸಾಹಸ ರಥಕ್ಕೆ ಸಾರಥಿಯಾಗಿ ಮುನ್ನಡೆಸಿದೆ. ನಿನ್ನ ಬಾನಂಗಳ ಕೆಳೆದೊಯ್ಯುವ ರೆಕ್ಕೆಯಾಗಿ ಕೂಡಿದೆ. ಬೆಂಗಳೂರು ವಾಯ್ಸ್, ಬೆಂಗಳೂರು ವಾಯ್ಸ್.
Bengaluru Voice. Listen to your heart.